Cerebral palsy is a group of disorders that affect movement and muscle coordination. It is caused by damage to the brain that occurs before, during, or shortly after birth. This damage affects the brain's ability to control movement and posture. Cerebral palsy can range in severity from mild to severe. Some people with cerebral palsy may only have minor difficulties with movement, while others may be unable to walk or talk. Early intervention is crucial for children with cerebral palsy. With appropriate therapies and support, children with cerebral palsy can reach their full potential.
Cerebral palsy is categorized into different types based on the movement disorders they cause. The most common types include spastic cerebral palsy. This type is characterized by stiff muscles and exaggerated reflexes. It is the most common type of cerebral palsy, affecting about 80% of individuals with the condition. Spastic cerebral palsy can be further classified into subtypes depending on which limbs are affected. Spastic diplegia primarily affects the legs, causing stiffness and difficulty walking. Spastic hemiplegia affects one side of the body, with the arm usually more affected than the leg. Spastic quadriplegia affects all four limbs, often accompanied by intellectual disabilities and seizures. Dyskinetic cerebral palsy. This type involves involuntary movements, such as twisting, writhing, or jerky motions. These movements can affect the face, arms, legs, and trunk. Ataxic cerebral palsy. This type affects balance and coordination. People with ataxic cerebral palsy may have difficulty with fine motor skills, such as writing or buttoning clothes. Mixed cerebral palsy. Some individuals may have symptoms of more than one type of cerebral palsy. Understanding the type of cerebral palsy is important for developing an individualized treatment plan.
Cerebral palsy is the most common motor disability in childhood. It affects approximately 1 in 500 children worldwide. While cerebral palsy occurs in all races and socio-economic groups, some studies suggest slight variations in prevalence across different regions.
Cerebral palsy is caused by damage to the developing brain, and several factors can increase the risk. These risk factors can be categorized into 3 main periods: prenatal, perinatal, and postnatal. Prenatal risk factors: premature birth. Babies born before 37 weeks of gestation have a higher risk of cerebral palsy. Low birth weight. Infants born weighing less than 5.5 pounds are at increased risk. Multiple pregnancies, twins, triplets, or other multiples are more likely to develop cerebral palsy. Infections during pregnancy. Certain maternal infections, such as rubella or cytomegalovirus, can damage the developing brain. Maternal health conditions, conditions like thyroid disorders, uncontrolled diabetes, or high blood pressure during pregnancy can increase the risk. Perinatal risk. Factors: birth asphyxia, lack of oxygen to the baby's brain during labor or delivery can cause brain damage. Difficult or traumatic birth, prolonged labor, abnormal fetal presentation, or the need for assisted delivery can increase the risk. Postnatal risk factors. Head injuries. Severe head trauma from falls, accidents, or abuse can lead to cerebral palsy. Infections, meningitis, encephalitis, or other severe infections affecting the brain can cause damage.
Recognizing the signs of cerebral palsy can be challenging because the symptoms can vary widely from person to person. It really depends on the severity and the location of the brain damage. Some individuals may experience mild symptoms, while others may have significant impairments. Motor symptoms are quite common. Muscle stiffness or spasticity is one of the most frequent symptoms. It makes the muscles feel tight and difficult to move. Then, there are involuntary movements. These can include twisting, writhing, or even jerky motions. Poor balance and coordination are also common. This can make walking, running, or even fine motor skills quite challenging. Delayed motor milestones are another sign. For example, not sitting, crawling, or walking at the expected ages. Now let's talk about developmental delays. Speech and language delays can be a big part of cerebral palsy. This includes difficulty speaking, understanding language, or communicating effectively. Cognitive impairments can also be present. This might mean learning disabilities, intellectual disabilities, or problems with attention and memory. Early recognition and diagnosis are crucial for providing appropriate interventions and support.
Cerebral palsy arises from damage to specific parts of the brain responsible for controlling movement, muscle tone, and posture. The type of cerebral palsy and its associated symptoms depend on the location and extent of the brain injury. Spastic cerebral palsy. Damage to the motor cortex, the part of the brain that initiates voluntary movements, leads to spasticity. This damage disrupts the normal signals from the brain to the muscles, resulting in increased muscle tone and stiffness. Dyskinetic cerebral palsy. Injury to the basal ganglia, a group of structures deep within the brain that regulate movement and muscle tone, causes involuntary movements. This damage disrupts the brain's ability to control and coordinate movements, leading to uncontrolled twisting, writhing, or jerky motions. Ataxic cerebral palsy. Damage to the cerebellum, located at the back of the brain and responsible for balance and coordination, results in ataxic cerebral palsy. This injury affects the brain's ability to coordinate movements and maintain balance, leading to unsteady gait, poor coordination, and difficulty with fine motor skills. Understanding the specific brain regions affected in each type of cerebral palsy provides insights into the underlying mechanisms. This knowledge guides targeted interventions. Early intervention and therapy can significantly improve outcomes and quality of life.
Cerebral palsy is generally attributed to brain damage that occurs before, during, or shortly after birth. Genetic mutations can affect brain development. Infections during pregnancy, like rubella, can damage the fetal brain. Birth asphyxia is a significant cause of cerebral palsy. Premature infants are more vulnerable to brain injury. Severe head trauma can lead to cerebral palsy. Often a specific cause cannot be identified.
Diagnosing cerebral palsy involves a comprehensive evaluation by a team of healthcare professionals, including pediatricians, neurologists, and developmental specialists. The process typically includes medical history and physical exam. The doctor will gather information about the child's birth history, developmental milestones, and any concerns about movement or development. They will perform a thorough physical exam, assessing muscle tone, reflexes, movement patterns, and overall development. Developmental assessments. Standardized tests and observations may be used to evaluate the child's motor skills, cognitive abilities, communication skills, and social-emotional development. This helps determine the presence and extent of any delays or impairments. Imaging studies. Brain imaging techniques such as MRI, magnetic resonance imaging, or CT, computed tomography scans, may be used to visualize the brain and look for any structural abnormalities or signs of damage. These scans can help identify the location and extent of brain injury. Additional tests. In some cases, additional tests may be recommended, such as electroencephalogram, EEG, to assess brain electrical activity, genetic testing, to identify potential genetic causes, or metabolic screening to rule out other conditions. Early diagnosis is crucial for cerebral palsy as it allows for early intervention and therapy. Early intervention can significantly improve outcomes and quality of life. Consistent therapy and a supportive environment are essential for achieving the best possible outcomes. The goal is to maximize the individual's abilities and promote independence.
While there is no cure for cerebral palsy, various treatments can manage symptoms and improve quality of life. Physical therapy focuses on muscle strength, flexibility, balance, and mobility. Occupational therapy enhances independence in daily activities. Speech-language therapy addresses communication and swallowing difficulties. Medications manage symptoms like spasticity and seizures. Assistive devices improve mobility and independence. Early intervention and consistent therapy are essential. With the right support, individuals with cerebral palsy can lead fulfilling lives.